depth, direction, duration. How deep are you pushing? What direction are you pushing in? And for how long? I can't think of a manual therapy technique, and you can throw all of them out there that don't have some either opinion or it layered into their thing in some way of depth, direction, duration. And so if we're not, and this is important because as a manual therapist, sometimes you're working on tissue and you're not thinking about, and I'll use the hamstring again. I'm not thinking about which hamstring am I on, right? And I'm kind of getting lost in the work and I'm freaking out. Like all I got to do is go, okay, where do I feel something unique within this layer of tissue? And then I will move the knee angle, I'll move the joints to then, of course, create tension, take away tension. And as you add and take away tension, it's like taking a trampoline and like bending it sides, like I bend the circle in and make it droop down. Or maybe it's like a circus, like the guys who jump off, like there's a fire and they jump off the building, maybe more like that because the trampoline's pretty stiff. I squeeze them in and then it gets droopy and I pull it out and it gets like really taut. And the same thing happens if I bend my arm, I can like push into my bicep, but if I straighten it, it goes trampolini, right? That's your depth. So I have to figure out moving around to what depth am I on, and then direction, and then I have to angle my fingers in some direction. The big thing is, scar tissue and things like that is misguided collagen. So the direction often, and this is a very big FR principle, we go in the direction of the striations, I would say. And then duration, how long are you going for? This is gonna be my last slide, I believe, is duration.